Welcome back. So good health starts at a young age, and with everything going on right now, it may feel like a good idea to put off some doctor appointments, but that is not the case. I spoke to Chief Medical Officer for UnitedHealthcare, Dr. Arethusa Kirk, and she gave us some expert advice. So, Dr. Kirk, why is children's wellness such an important topic to discuss with new parents and their guardians?
Yes, at UnitedHealthcare, our mission is to help people live healthier lives. So we're really here to amplify the message from the American Academy of Pediatrics and the American College of Family Physicians that it's very important for infants, toddlers, and all children to be able to get into their clinics for their preventive well visits. Telehealth has brought so much advantages to families, especially during COVID, but the preventive visits are really our opportunity for children to get their full physical exam, the laboratory screenings they need, as well as vital immunizations and developmental screening.
You're stressing that children's wellness visits are actually a preparation, and that's key. So what do we need to take into account maybe before that appointment?
The cornerstone of pediatrics is prevention. And certainly during COVID-19, everything has really changed. Going to the hairdresser and the grocery store is very different. And going to your primary care pediatrician and family practice is no different. So calling ahead to get a sense of what the protocols and screening might be ahead of time will really reassure families about the infection controls that are happening. For infants, basically within the first 15 months of life, there are actually 8 core visits. And so it's really easy to get behind. And so it's important to just look at the schedule and ensure that you've gotten back into the clinic. At our website, uhc.com/children's wellness, we provided checklists for families to be able to prepare for these preventive visits.
So talking about those core visits, we know they're important, but what can be expected during this series of appointments?
So I mentioned during the first 15 months of life, there are actually 8 core preventive visits. And we know that infants are growing at an exponential rate during that time, and their development is changing significantly as well. So during those visits, we're doing developmental screening, the physical exam, as well as core immunizations. The immunizations start at as early as 6 weeks and usually follow every 2 months with a core set. So it's easy to get behind, and families really, pediatricians and family practice providers know this and have an easy catch-up schedule to get you back on track.
Well, the Children's Wellness Resource is available at uhc.com/children's wellness. You can also see and download the information on well visits and vaccinations.